Hello everyone, my name is James Marks. Over the next 5 minutes, I'm going to be walking you through the background of a difficult situation and describe to you how better knowing yourself, your good habits, and your bad tendencies can improve or degrade tensions, relationships, and coalitions. In business in general, and healthcare in particular, change is constant. It can be disruptive and even sometimes violent. The healthcare industry is heavily regulated, and the past 5 years have shown significant change being forced on the industry. With change, there is always conflict and challenges that must be overcome. Leaders that do this effectively take intentional steps to understanding themselves and how they can best react to crucial conflicts and conversations. The Myers-Briggs Type Indicator is one such tool that can help leaders understand themselves and their tendencies. This by itself is not a cure-all, and effective leaders should look for multiple self-discovery tools and implements. Much of what's to come will focus on the upper level of Maslow's hierarchy of needs, or self-actualization. This is the part of human nature that arises once all other needs are met, as we strive towards becoming the best version of ourselves. As I mentioned, government is a very large force in the healthcare industry. Legislation in recent history, most notably the Affordable Health Care Act and the High-Tech Act, have placed a large burden on healthcare providers. In these acts, the U.S. government has mandated that healthcare organizations jumpstart their technology and information systems programs and use it to improve health outcomes, much in the way Amazon has revolutionized supply chains with their use of analytics and business intelligence. These projects typically take 1 to 2 years, depending on the scope and urgency of the situation, and can run in excess of $25 million. The challenge that healthcare organizations face is that this technology did not exist. They are not in the business of making their own software or technology, and the companies that do make it charge premiums due to the mandated urgency and timelines of the regulations, as well as the size and scope of the healthcare continuum of care. This is not a single software application. Outpatient care, for example, in a doctor's clinic, is far removed in terms of processes, steps, and functions than, say, a radiology department, inpatient medicine, surgery functions, laboratory, and so on. Furthermore, the integration of administrative and business functions is implied in these regulations, such as registration, coding, billing, and collections. Furthermore, and probably most importantly, healthcare disciplines have historically operated distinctly and separately from each other while supporting each other. The new technology requirements force them to integrate with each other in ways that they've never had to before. This means that when healthcare organizations have had to implement, separate departments had to work together more collaboratively than ever before, and many had hard conversations and hard concessions that had to be made to get the systems and the processes to integrate to the level required by the mandate. The challenge is that the reason a healthcare company exists is to provide care and improve people's lives. We all know this. For a very long time, business costs and cash considerations are seen as an afterthought, living by the at-any-cost mantra. Many clinicians and clinical leaders have not had to integrate with the business side of healthcare to the extent ever before, and adjusting the way they delivered care, they practiced, and in some cases even the way they've treated patients to meet certain business requirements was not a pleasant or welcomed experience for them. I've been involved in several of these projects, leading many aspects of them and managing the project altogether in other instances. One thing that I would recommend unequivocally to any leader entering into a project of this size and scale is to regularly self-evaluate. It's important for the project to ensure milestones are hit, that the project is on task, on time, and on budget. It's important for you and for your career that you take these learning opportunities and improve yourself. These projects offer individuals a chance to jumpstart their self-actualization journey, as there are many learning opportunities along the way. In these large projects, individuals of all walks of life and backgrounds are present and are screaming to have their opinions and voices heard. It's important for any good leader to know themselves and how to work with a diverse array of people introverts and extroverts alike. Regardless of where you fall in the MBTI, we all will exhibit some of each type along the way. Regardless of whether you're an introvert or an extrovert, you need to learn how you can most effectively communicate and work with both types. During the course of the project, sense all of the facts that present themselves and intuit any patterns, trends, impressions, or perceptions that cannot be measured readily or rapidly. Everyone should try to be a thinker when the project needs it, and be a feeler when the people need it. Leaders should know when to make decisions and be the judger when decisions along the project's critical path, but be a perceiver, free from judgments, when it doesn't.